you've got your individual case safety reports and all the many attachments we often get with those, whether they're clinical narratives or patient letters and reports, et cetera, and that case gets bigger and bigger. You would want to be able to search those attachments for terms, perhaps the terms that were tagged in the cover ICSR, et cetera. So this is a way to take advantage of both structured content like MEDRA terms, but search your unstructured content for the right attachments and narratives so that you can really study what you're seeing in the report.
Right. And maybe now that you've drilled into this one and you think that this is really a critical article, you might want to go sit there and say, okay, now I want to go take this exact document and I want to now look at PubMed Open Access. So I'm now using not that clip that we started from the medical letter. I'm taking this document or any other document you want to use and now saying, find me things in the other workspace. So again, someone could have sent you an email, or you could have looked at a document in your workspace from Documentum and then said, oh, I found this interesting article internally. Now I'm going to look against PubMed or the FDA guidances or some other workspace.
And John, while we're in PubMed, talk a little bit about Medline and where we're going with the full Medline repository.
So this is for demo and trial purposes. We are processing and have the 24 million full abstracts, and that's a separate workspace that's part of the product offering. So if you license the Cerebrant for pharmaceutical, then you would get, as I said before, the PubMed Open Access. You'd have the million or so articles that we have the full text rights to, the 24 million abstracts in the Medline workspace. You would have the FDA guidances and maps, the general news as we described, and Wikipedia, as I call it, for fun.
And then if they wanted to add their own stuff, that's possible too.
It's very quick and easy to add and create your own workspaces. All this is sitting in the Amazon environment as highly secure. As I said, we have a little bit of experience working with our friends in the intelligence community, so we understand security and how to keep the rest of the software pretty well locked down. We have some interesting patents. So we have some good ways to support and protect your information.
And while the out-of-the-box implementation is secure, as John was talking about, naturally in pharma and biotech, we have a lot of concerns around the FDA requirements. Are we touching 21 Part 11 certified content, et cetera? While this is a general overview, that's certainly something we talk about every day with people. So if you're interested, we can go over those kinds of issues.
Great. So one other visual that allows people to kind of do things, and just kind of wrapping up on that, and we'll kind of move on from there in a minute. Here, all I did was take in PubMed and say, I want you to give me all the different clusters of the different types of journals. So you can see Dove Medical Press is the largest, Biomed Central, kind of organizational pieces. Along the outside are authors, so the top authors. So if I just pick one of the authors and hover over it, you can see which journals or publications that person is in. The other
And I like, again, to compare this to another type of tagging. If you are working with a CRO, or you are a CRO and you're a big one and you work with 200 or 300 sites globally, you often want to see what clinical investigators are involved with one or more sites and what are the specialties of that site. Is it a phase 1 site? What is it? This is a nice, fast way to create visualization around that information that, in your case, might just be trapped in clinical plans, patient diaries, and other documentation.
And we won't spend much time, but you can also add any filter that you want, so you can kind of add some things. But the other thing you can do is once we hover over any one of these, we can give you background on the information, what documents are related, and how are they related. So.
And this is a really fast overview. It doesn't even touch on all the capabilities. But one of the things that I like about it when we go in more detail with pharma biotech is this is a way to start searching content with a concept, but then there are ways to get down to the keyword concept or a Boolean search across that same content. So it's kind of the flip of what we've had to do in the past, where all of us had to search on keywords and get a whole bunch of content and then read it to see if it was conceptually relevant. This instead allows us to quickly go from 1 million documents to the most conceptually relevant 1,000 or less, and then apply keywords if necessary.
Right.